join us live. Hello, take support.
Yes, we are.
Yeah. So, and thank you so much for joining us in today's webinar. Our endeavor is to spread awareness about rabies, and which is, as you all know, which is totally fatal and can be avoided once appropriately vaccinated. And this is an initiative done by Kedila through its innovation to serve the society and humankind. And the topic of today's webinar is novel 3-dose G protein vaccine, the ultimate care for compliance. And dear doctors, Travis is world first 3-dose anti-rabies vaccine. And we take great pride. We would like to inform you that Travis has successfully completed 1 year of launch, and with more than 40,000 animal bite victims being vaccinated, 100% compliance was recorded, and no case of adverse events was registered. And with this, it's my honor to introduce to you to our today's speaker of the webinar, Dr. Gao sir. And now I would like to request Gao sir to initiate the talk, and later we'll have a Q&A session also. And I request all the participants to drop questions in the Dropbox, and we will read out the questions after the presentation. Thank you, and over to you, sir.
Okay, first of all, good afternoon to everyone present here. I would like to introduce myself. I am Dr. Minking Gao, and I have been posted in Arunachal, Namsai district since the last 2 years as a medical officer. So as Sahil has explained before, the topic for today is the 3-dose G protein rabies vaccine. But before we start with the presentation, I would like to just put a simple overview regarding what is rabies and what are the epidemiology, infection, risk factors, and the treatment. And as you all know, that rabies is a viral infectious disease, which is caused by the Lisa virus, which falls under the family of the rhabdovirus family. And it is not endemic to humans. It is a zoonotic disease, which means that it infects humans from the bite of different animals. And most commonly, like dogs, and in other countries, it might be bats, raccoons, etc., from mammals. And since the conception of rabies vaccine in the 1800s, the dose started with around 30 plus doses, and then gradually it tapered to 10, 15. And now the most common dose that we practice in our daily every healthcare center, which is of 5 doses, the regimen following the 0 dose, and on the 3rd day, the 7th day, 14th day, and the last, including the 28th day. So before we start with the presentation, I would like to congratulate Kedila Pharmaceutics, which have been working on this vaccine since the 2010s. That is, more than 13 years have been completed. And the last phase of the testing, the clinical trials, which was completed on the September 2021, and it launched its product on the market around last year on 2022. So as you all know that rabies is an infectious disease, which infects around 50 to 60,000 people per year, which results in death. And almost half of those cases, like 25,000 to around 30,000, are secluded in the Southern Asian region, which includes India. And India, being a developing nation, being with most of its population in the rural general population, it's easy to neglect that people don't have much knowledge about this vaccine, about the infection, about the cause, about the result, which ultimately results in death. So now I would like to start with the presentation. Can you please move to the next slide? Hello. As shown here, globally 59,000 human deaths annually are recorded due to the rabies virus. And in India, it has been recorded for around 20,000 human deaths a year, accounting to 60% of rabies deaths in Asia and 35% of the global deaths. And 91% deaths in India occurred in rural areas, as stated before, because in the urban populated areas, the vaccine, as well as at the dogs, those who infect the humans, those are also vaccinated. So it's much more easier for the general population living there to not get infected. Next slide. The current management of rabies vaccine or the rabies virus, it's as, it's as followed. At the site of infection, we advise the patient to wash the site wound, the injury site, with under a running tap water with either soap or plain water for around 10 to 15 minutes to clean off the infections, the local infection. And then there is the active immunization and then the passive immunization with rabies immunoglobulins. And as shown below, we can see the 5-dose intramuscular regime comprising of these dose on the 0 day, 3rd day, the 7th day, 14, and the 28, which are to be administered on either the anterolateral aspect of thigh or in the deltoid region. And the rabies vaccine is never to be administered on the gluteal region. Why? Because the gluteal region comprises most of adipose tissue, which will hinder with the action of the rabies immunoglobulins. Next. Next slide. The most common cause of death in rabies infected individuals is always non-compliance because once the symptoms start to show, it's really, really difficult. I mean, it's almost next to impossible to treat the patient. And as we all know, that the incubation period, that the period between the site infection site and the presentation of the symptoms, which is called the incubation site, it differs in every patient, every other patient. So it can vary from either one day, a few days, like a week, or it may last up to a year. So the non-compliance part, it's mostly present in the rural people because it's really difficult to make them understand the importance of taking this vaccine. And most of all, the vaccine, which comprises of five parts, it it also costs a bit, around 2,000 rupees in Indian Indian rupees. So the current rabies vaccine are all cell culture vaccine, and the inactivated vaccines are more than 50 years old technology, which was developed around 1960s. So it was inconsistent in potency, stability, ability. It was short supply because not all the government centers had this rabies vaccine, and adverse events which may cause either inflammation, pain, swelling at the site of rabies vaccine injection. Okay, next slide. Next slide. Compliant of anti-rabies vaccine. Compliant patient, it can be categorized into three departments. Those patients who are compliant, the delayed compliant patients, and the dropout. And the compliant patients are those who receive all the rabies vaccine doses. That is the scheduled dose of ARV, anti-rabies vaccine, on the recommended dates as stated before. And the delayed compliant patients are those who completed the scheduled dose of RAV within 60 days, but they waited from the scheduled regimen. There, which means that there might have been a gap of around 1 day, 2 days, 3 days, or which culminated to more than 60 days. And the dropout or non-compliant patients are those who had taken at least one dose of ARV, that is the starting dose of either 0, 3rd, or 7th day, and after the animal bite, but not completed all the scheduled doses, like the 14 and the 28 days. Hello?
Yes.
Hello. Next slide. And this presentation.
Hello.
Hello. Hello. So this presentation is a list of it is a list of test subjects, around 110 patients who have taken the 4-dose rabies post-exposure prophylactic dose. Hello. Hello. Sahil.
Sir, your mic is on, sir. Your mic is on, sir.
Yes, yes, my mic is on. I mean, am I audible?
Yeah, you are audible. Sir, your
Okay,
voice
okay.
was breaking, but now it's audible. Yes.
Okay. This page shows the test result of a clinical trial tested on around 110 patients who had taken the 4-dose post-exposure prophylaxis vaccine as recommended by the WHO. The shortcoming of the management of the patients were found to be late initiation of the rabies post-exposure prophylaxis in travelers, and the administration of human rabies immunoglobulin, which can't be injected in the same site as the post-exposure vaccine. In conclusion, patients did not always receive the optimal post-exposure doses under real-life conditions, and a significant proportion of patients, those who had taken 3 or more doses of the post-exposure vaccines, did not have the required amount of antibodies, which would have to be found in those who need to have taken all these vaccines. Next slide. This is just an example of few case studies. As you can see in the mark area, these patients have not completed the doses. They have only taken the first, second, and third dose, which was in the regimen included in the 5-dose regime. And as you can see, the patients were discharged within a few days against medical advice, and one of the patients had taken leave against medical advice only following 1 or 2 days, even after they had showed symptoms. So as you can see, the most important part is that is to be noted is that the patient here, those who have expired, they were already symptomatic. So it is important to note that the post-exposure prophylaxis will only work in those patients who are in the incubation period. That is from the day of injury and before the patient starts showing symptoms. And once the patient starts showing symptoms, it is of no use even if they take the post-exposure doses. So as you can see here, the patient had developed symptoms like fever and they had complaint of dog bite. And the outcome is always that if they don't comply with if they don't comply with the regime before the infection starts. Next. And this test conducted by Manasi Panda and Richa Kapoor at Savarajya Hospital in Delhi. Almost at least around 360 patients were taken who had been infected by, as per the rabid animals. And 53% of these people were non-compliant to the course of anti-rabies vaccine. And as stated before, the non-compliance patients are those who do not take the whole dose of the 5-day regime. Next. As shown in the graph, on day 1, there are around 100 patients. On day 3, 88, and on day 14 and day 28, there is a decline of at least 30 to 60 patients, which only goes to show that the patient will only comply as much as the doses are less within. As shown here, on the 0 and the 3rd and the 7th day, the 3 doses which can be taken within a week period, it is much more easier for the patient to be complied with the course of the rabies vaccine. And one of the most common causes of non-compliance, as told by the patients in recent study, it was said to be loss of wages. They have to skip their daily routine. They have to opt out of work to get vaccinated on 5 different on 5 different occasions. And one of the most important reason was that each vaccine costed around 300 to 400 rupees. And the other reason for non-compliance with school timing in kids, distance from hospital, those living in rural areas, and costs incurred and forgotten days. One of the most common. Next. As shown here and stated before, one of the earliest rabies vaccines, which was developed in the 1880s, it can be seen here that there were 30 or 31 injections given to the patient, to a single patient. And gradually, as years gone by and the vaccines developed much further, around 1911, it reduced to around 14 injections. And in 1976, when the 5-dose regime was developed, and still till now, we are taking the 5-day regime rabies vaccine. Next. 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 There are 5 different points in which why the 3-dose recombinant rabies G vaccine is much more easy to be complied for the patient as well as the general public. First, it is the first protein subunit vaccine prepared by the viral-like protein platform technology. First vaccine with 3-dose intramuscular regime of 0, 3, and 7 days, and better compliant with patients because the whole of the complete regime can be taken within 7 days and convenience ready to use with no reconstitution needed. Next. Next. Oh, and as the slide shows, VLP stands for viral-like particles. Viral-like particles are those which mimics the virus characteristics without infecting the said host. So it can be, as it can be shown here, the G protein, which was difficult to be isolated, it can be isolated using the viral-like particle proteins. And once isolated, it mimics the viral antigenicity without being pathogenic to the said host, which is of utmost important in case of developing a vaccine. And once they have developed the vaccine, they are capable of inducing a strong humoral as well as a cellular immune response. And ultimately, VLPs, that is viral-like protein and particles, can be used as a vaccine. This is just the serological data, which shows that those who have taken the 3-day course released adequate amount of antigenicity, like antibodies, which were found in test individuals. Next. And this is just a headline regarding clinical phase 3. The safety and immunogenicity of a novel 3-dose regimen, nanoparticle, that is the viral-like particles, rabies G protein vaccine administered as stimulated post-exposure immunization and randomized trial. And this was to just show that the 3-dose regime was adequate in amounting to produce adequate amount of that antigenicity, which resulted in adequate amount of antibodies, which help in preventing the development of rabies symptoms. Next. And this is the phase 3 before it was launched in the market, which was concluded in September 2021. It comprised of 800 test subjects, age range ranging between 16 to 65 years. It is important to note that it did not include any pediatric patients or any pregnant patients, and it was completely successful as it was conclusive in study that they had adequate amount of antigen on serological test, which help in prevent the rabies symptoms. This is just the serological data. And it also shows that the 3-dose regime resulted in decreased amount of adverse drug reactions like localized pain, redness, swelling, fever, headache, etc., which was associated with the earliest 5 regime doses. So we can conclude that the novel 3-dose was not inferior, but at par with the 5 regime dose. It had less adverse reactions as compared to the other vaccines, rabies vaccines, and novel 3-dose is safe and can be used for the general public, as along with the 5-dose of WHO certified vaccines, as we had been using before. Okay, I think that concludes the meeting for today. So thank you for Kedila Pharma.
Thank you so much, sir. We
Okay.
have received a few questions from our panelists. So one of the questions that we have received, sir, 5 cases almost often subject to get, sir. The panelists wanted to know about what kind of innovative 5 cases you faced.
Okay. Global.
Hello.
Hello.
Sir. So
Huh.
the question was from one of the panelists that what
Okay.
uh, kind of animal bite cases you get generally.
What kind of?
So animal bite cases you get.
Hmm. Oh, I mean,
मतलब
of course,
आपको
the
सर
most,
हाँ हाँ
haha, the most
हाँ
common is the dog bite, and then we regularly get cat bite, domesticated cat bite, as well as rat, and once or few we get bites from like stray animals like pig, etc. Most common
हाँ
is cat and dog and mice.
and non-compliance rate is also very much high over there also, sir, I guess.
Yeah,
Non-compliance
non-compliance rate is
rate is
very much
हाँ
high. We have to continually, we have to talk to the patient, advise them why is it important that it's a non-curable disease. So you have to take the vaccine on the given time. And it is also important to note that once the patient is semi-compliant, like they may have skipped 2 or 3 days, so we can just follow the
हाँ
same regime, but we have to add 2 or 3 days, the days which have been skipped on the upcoming dates. Like 17 will turn to 21, and on the 28th day, we have to take on the 31st day. We have to add the dates which have been skipped.
sir. So you are using already using Travis, sir. So you really think,
Hmm.
sir, that Travis is very much helpful in case of non-compliance also, sir?
I mean, although Travis is much more easier for non-compliant patients because the whole regime can be taken within a 1 week. But the only complaint of the patient is that it's a bit much costly as compared to the previous dose. I mean, each pack
Uh,
costs around I think 750 rupees. So it total
So
amounts
750
up
rupees. The
to
whole
like
regime will cost sir somewhere around 2100
2200,
rupees, sir.
21 to
And
2200.
yeah, 2100
Hmm.
rupees. And the sir,
Hmm.
that sir, that's not a very much difference in terms of price, but it will be complete also in 1 week, and that is almost 28 days because
Hmm.
with this, I'd like to thank you, sir, for the information. We truly, in Kedila, sir, we truly appreciate your efforts, sir. But last but not least, sir, we would like to inform on sir two prestigious awards in innovative categories, sir. One is ET India Pharma Award, and another is Golden Globe Tiger Award.
Golden Globes, Tigers.
And yeah, Tiger. With this, sir, we would like to end our session.
Okay. Thank you, Sahil.
Thank you so much, sir. Hello, tech support.
Okay.
On the live. Yeah, yeah,
Okay. So we can end the live.
yeah.
Okay. Hello. Hello,
Hello, tech
Sahil.
support. We can end the live. Yes, I can
Okay.
hear, sir, but
Okay. Okay.
it is still live, I guess, sir. Just give me a
Yeah.
minute.
No, I have to
No, no.
end the meeting. We can't end the live with meeting.
Uh-huh. Hello.
No, no, it's fine. I'll just leave the meeting.
हाँ.
Okay. Thank you,
Yeah,
Sahil.
yeah, yeah, yeah.
Hmm.
Okay,
Okay.
welcome, sir.
Bye.
I'll call
Okay.
you, sir. Okay, bye.
Okay. Bye.